Today at New York Presbyterian Hospital, neurologists are achieving promising results for stroke recovery using robotic therapies.
Every patient who comes in with a stroke, depending on what kind of deficit they may have acquired, weakness on one side or loss of speech, the biggest concern is how much am I going to get better? Is there a chance for me to return to work, to get back to a normal life? What is my life going to be like after having had this stroke? And so with that concern in mind, the whole field of neurorehabilitation is kind of the answer.
There are several robots being used for this type of therapy, including Rio Go, the Myomo E100 neurorobotic system, and InMotion 2 shoulder-elbow robot. All three devices provide movement stimulation to different parts of the arm. Using varying amounts of assistance and resistance over constantly repeated movements coupled with visual stimuli, many patients experience slow but steady restoration of limb use.
Humans get tired, they get bored, they have a tougher time doing something over and over again. At the same time, the robots can provide a level of entertainment for the patient to keep them engaged. Depending on what device and how it's programmed, some of them have visual displays and games the patients are playing, sort of like you might play on a computer, to keep the patient engaged in their therapy and paying attention and to help with fatigue issues.
On May 26th at 7 p.m. Eastern Time, New York Presbyterian Hospital will present an OR Live webcast featuring robotic stroke therapy. Dr. Joel Stein, Physiatrist-in-Chief and Director of Rehabilitation Medical Services at New York Presbyterian Hospital, and Dr. Randolph Marshall, Director of Stroke Division at New York Presbyterian Hospital, Columbia University Medical Center, will provide detailed descriptions of therapy video along with clinical results. The webcast will be moderated by Dr. Matthew Fink, Chief of the Division of Stroke and Critical Care Neurology at New York Presbyterian Weill Cornell Medical Center.
A few years ago, scientists looking at other animals discovered something which to us was quite remarkable, which is that new brain cells actually can grow in damaged areas, something called neurogenesis. It was something that none of us thought ever happened in the brain, and when that was discovered, all of a sudden there was this tremendous amount of activity in rehabilitation, because we said, oh my God, if new brain cells can grow, let's figure out how to stimulate that and get people to recover. So there were two approaches. One was to directly stimulate the brain on the surface with either magnetic stimulation or electrical stimulation, and that was one approach which seemed to stimulate the growth of new connections, new brain cells, and the other was to stimulate what we call the end organ, the periphery. So if your hand is paralyzed and you passively stimulate the hand by repetitive motion, and that's what the robots do, then there's a retrograde stimulation that occurs. Somehow, we don't fully understand that something works its way back up the nervous system, back to the brain, and then stimulates the brain to make new connections in that fashion. And then if you actually can combine both the robotic stimulation of the hand as well as electrical stimulation of the brain itself, then potentially you could have a really robust type of recovery, which we haven't seen before.
Please join us on May 26th at 7 p.m. Eastern Time from New York Presbyterian Hospital in New York City for a live webcast featuring these exciting developments in robotic stroke therapy.